We want to be very mindful of everyone's time here today. We understand it's a little crazy out there. Also, Dr. Lemansky's time. He's consulting with patients pretty much 18 hours a day. So we want to be very mindful of his time. But he's going to share with us briefly just on how we can start to use remote health monitoring. Probably now, more than ever, we need sophisticated ways to be smart, to use technology to remotely monitor vital signs, ideally to keep people at home where they can be safely monitored and unnecessarily going into the hospital. And in general, we're going to cover the Heads Up platform beyond just some of the urgent vital signs we'll talk about today in terms of how this can be a holistic health records platform in your business. So TJ, let's kick it off, and maybe we can have an introduction here and
Yes.
be mindful of John's time, and then dive
Yes.
into a technology demo and make this engaging and fun.
You bet. Sounds great. Well, again, everyone, my name is TJ Anderson. I've been the one emailing, texting, or calling with you. I run our coaching and practitioner portal here, and you just met Dave. Dave is our CEO and founder, and then as we also mentioned, Dr. John Lemansky, our Chief Medical Officer, is on with us as well. And so, as Dave mentioned, we're going to go ahead and cover these topics today: an overview of who we are, again, who is Heads Up Health, a brief demo of our platform, as well as an overview specifically about our brand new COVID-19 health tracking dashboard. And John is going to go into details a bit about those metrics here at the beginning. We want to be mindful of your time, John. I know you've got back-to-back calls. You're actually working remotely, running telemedicine calls with clients and patients. So, and then at the end of this call, if you stay until the end, we will share about ways that you can get access to exactly what we have at the Founders Club here, the opportunity to join Heads Up Health and use this with your clients. This is what more important time in our world to actually find a great tool to be able to remotely monitor your patients from anywhere in the world, remotely monitor your clients on the most important metrics, to be able to keep your practice alive during this time, crazy times we're in, and actually support with better outcomes. So I'll go ahead and pass it over to John right now. John, if you want to give a little brief background on yourself for everyone on the call right now, and then we can talk a little bit first about the new tracking dashboard.
Okay, sounds good. Thanks, guys. Great to be on with everybody. Thank you for everybody who's on and taking some time to learn about the platform. So as TJ and Dave mentioned, I'm the Chief Medical Officer. I'm internal medicine physician. I've been practicing a lot longer than I'd like to admit. And I've worked as a hospitalist, and I still do go from time to time. I'm actually signed up to go to New York in the next couple of weeks. So hopefully that situation is getting a little bit better. I've been with Heads Up Health now for quite a while. Dave and I met a couple of years now ago. We both have been very, very keen on data as far as how we can use data, the right kind of data, to really kind of optimize not only our own health, but the health of our patients. So I have a private practice now where I do preventative health, kind of longevity medicine. And so we've kind of really tied in together as far as isolating the metrics that I use to make sure that people are healthy. On the side, I also do a telemedicine business that I co-own. And in the last 5 weeks or so, our volume on telemedicine has gone exponential, mostly obviously due to the coronavirus and kind of the downstream effects. As many of you might know, our hospitals are being stressed tremendously, but what's not being reported is that many clinics are shutting down. And so there's really nowhere for people to go to get health. And it's either ER, urgent care, or seeing their practitioner through a telemedicine platform. So I wanted to briefly talk about kind of what I see with COVID-19 and why using kind of a tele platform, using Heads Up Health is going to be really optimal going forward, because I don't see a person-to-person interaction happening for quite a while. I know a lot of people people are using remote kind of communications with a lot of their patients if they're international or just throughout the states. But I think now more than ever, the business model is really going to go more to an online platform for the foreseeable future. I don't know where everybody is located, but I'll talk about the United States. So obviously in the last week or so, we've seen kind of areas that are starting to really get affected by COVID-19. And I would expect that's going to happen everywhere in the United States. So any major city, but also rural areas are going to be affected tremendously. And so we're going to be in some sort of kind of lockdown period intermittently or for an extended period of time. Pretty much right now, as Dave mentioned, 18 hours a day or so, I'm taking calls from telemedicine and my private practice. And I would say 90% of the calls are either related to COVID-19 or, because we're still in the flu season, cold season, a lot of people are having symptoms which may or may not be COVID-19, but are obviously concerned with what they're hearing on the news. A lot of my patients, and I'm sure a lot of people who are on this call, have comorbidities that are really going to predispose them to, if they do get this virus, they're not going to do very well. And so we have really kind of created a new part of the platform where we're going to isolate the vital signs and the metrics that we think will at least key you into maybe taking a look at your patients and giving them a call and saying, hey, I noticed X, Y, and Z. Maybe we should talk a little bit about your symptoms and see what the next steps are. So I think more now than ever, having a platform where you can actually remotely see some vital signs and some metrics is going to be really the key to getting this thing under control. And so we're trying to be a huge part of that program. So TJ, I can start going into maybe some of the ones on the new dashboard that we came up with and maybe briefly talk about why they're important if you guys want.
Yeah, I'll share my screen here, John. I've
Okay.
got a demo environment set up.
Sounds good.
And I just want to make one important point here before we go, and that's that Dr. Lemansky is obviously board certified and licensed and treating patients and making those difficult calls on when people should seek medical attention. A lot of our professional heads up health individuals are health coaches. They may be, in the case of Erica, a nutritionist, and they may not want to be making big decisions based on this data. And that's not the point here. I think the point is that you can provide this tool to your clients as something very sophisticated they can use, and that is something they can share with a doctor if they need to in a very serious medical setting. So I just want to make that important distinction here. Heads up is something you can provide to clients. It's sophisticated, it's powerful. You as a health practitioner will know when to draw the line in terms of your ability and when to defer out. And the benefit is that you're going to be deferring that client out with some incredibly powerful data that is going to help whoever they speak to make the appropriate decision. So it just, we have so many people with such different medical levels of specialization on the platform. I just want to distinguish that here before we go any further.
Yeah, Dave, and I think that's a great point. Having said that, I think we all need to play a role in terms of kind of really directing people who we have experience with. And so these metrics that we came up with, we feel can definitely kind of give you a head start in terms of maybe the people you're working with are starting to do a little bit worse than their baseline. And so
Totally. Yep. These are things everybody should know and be able to track and understand.
And then obviously you refer them out to somebody who is licensed and can make that call. Because I will tell you from my kind of personal experience in the last, actually now it's been about 6 weeks. We started seeing this early January, February, beginning of February, where it's really started ramping up before it got to the national news media, that this is going to be an issue that we're going to have to deal with. So I think that one of the things that most people want to know is this something that I have to worry about? Where can I go? How do I get tested? When should I make that call to go to the ER or urgent care? And so, yeah, maybe some of the people on the call cannot make that call, but they can actually refer them, say, hey, at this point, you need to either talk to your physician. If you can't get in touch with your physician, you maybe need to reach out to a telemedicine platform. If you have health insurance, a lot of them are, taking cash basis, and it's not, they're not trying to run up the costs on it. So it's not a moneymaker, but just know when to really refer people out to seek, medical attention, I think is the key.
So before we dive into these, we have a few people that have joined with us. So Michael, Shiva, and Troy, if you want to go ahead and introduce yourself as well to give us some more context about who you are, where you're at in the world, and tell us a little bit more about your practice. Welcome to the call. We are just now diving into the top metrics that we are empowering both health professionals and the individual client to actually track on their own during coronavirus, COVID-19 specific dashboard. So go ahead and dive right in, John.
Okay, yeah, so these are some of the metrics that we felt we didn't want to overwhelm people and say you need to look at 10 different metrics and try to make sense of it. So these 4 that we came up with, I think will give you a pretty good insight into kind of where your patients are at and when you really need to kind of make that call to say, hey, you need to seek medical attention. And so obviously body temperature is very important as we talk about COVID-19. Majority of cases, they are seeing fever. Now, a lack of fever does not necessarily mean you don't have COVID-19. So it's important to take that into context. If somebody has the classic symptoms, but not a fever, still probably needs to be referred out. But in general, what we're seeing with this COVID-19 is fever. And that fever usually is going to last anywhere from 5 to 10 days. So it's not something where they have a fever one time. It's something where they're having a persistent fever. And that can be a low-grade fever, so 99.9. We define a fever as 100.4 and above, and you can convert that to Celsius on the platform if you're in a country that's using Celsius as their metric. But basically, anything that is 100.4 and above, you need to start looking a little bit closer at that patient and saying, okay, maybe this is something I need to look into. We have set it up where you can trend it out. And so we recommend that people start trending their temperature, even if they're not having symptoms, just to see kind of where are we. I think the reality is that whether or not people are symptomatic, whether or not they're obviously being hospitalized, a lot of people are going to be exposed to COVID-19. And so one of the only symptoms sometimes is just fever. So it's important to get a kind of baseline, and I would start as soon as possible and then have your clients start trending their temperature. And so you can really key into, okay, they're starting to trend up. What is going on? Maybe they had a strenuous workout, which can raise your body temperature mildly. Maybe they're doing sauna. So you have to kind of dive into what's driving the temperature. But if it's a persistent elevated temperature, especially above 100.4, something that they need to really talk to their clients about. On the flip side, low body temperature also, and especially in elderly population, people with hypothyroidism, maybe some sort of adrenal insufficiency, you can see lower body temperature. And so it's important to almost have a baseline so that you can see, is there a deviation from the norm? If they're 2 degrees higher than their normal baseline, that might be for them a low-grade fever. So that's another important takeaway point. As far as temperature, I think that's pretty self-explanatory, and I think most people kind of understand that. The resting heart rate, which is the next tile that we use, is also important. So again, establishing a baseline, and this is resting heart rate, which you can get from either just manually checking and inputting the data, which everybody can do, or there are some devices that will actually check it for you and input it in. And so if they have those, you can obviously tie in the data. In general, for every degree of body temperature rise, you should expect about a 10-point increase in your heart rate. And so those should start to correlate. So if you're seeing elevated heart rate, elevated temperature, that's going to key you into, okay, this fever is probably real, and it's probably not due to some other extraneous circumstance. So trending the heart rate, especially in the morning, or especially if somebody's feeling febrile, they should be checking their heart rate to see, is this trending up? And then you can obviously trend it out on the dashboard. Oxygen levels, if anybody goes to Amazon and tries to buy pulse ox, I looked today, I think the delivery date is May. So that might be a challenge to get, but at CVS or any kind of drugstore, you should be able to get a pulse ox for $20–30, unless they've jacked up the prices.
eBay also, John. We're hearing reports
eBay.
that people are finding thermometers and
Okay.
pulse ox on eBay as opposed to Amazon.
And I would say, with this initial kind of surge in purchases, I do think that the supply chain for those two things will catch up. So
Yep, agreed.
I don't think it's going to be a long-term issue where you can't get anywhere to check your vital signs. But other devices can also monitor your O2 sats, not as great as a pulse ox. So I would really recommend that your clients go out and get one. When it refers to pulse ox, a lot of patients that we deal with might have some comorbidities, maybe COPD, lung issues, maybe some heart disease. So they might run a little bit lower than what we normally would like to see. TJ made a good point in a previous call that, if you're at elevation, your pulse ox is going to be a little bit lower. For most people, the range that you want to see is 96 and above. And then again, with this one, really the trend is important. So if you start seeing people trending down, especially at the 89, 90, 88 range, that is something that you really want to key into and say, okay, I need to talk to my client and see, why are they desatting? Is this a real, real measurement, or is this something that we need to have rechecked? In general, with COVID-19, obviously what you're seeing on the news is the people who are going to get sick, they're going to get sick very quickly, and they're going to go into some sort of respiratory distress, respiratory failure. And so, pulse ox starting to trend down is something that can really key you into, because let me backtrack and say most of the calls I'm getting, people are saying that they're short of breath. Now, shortness of breath can mean something, or it can mean, nothing. Are they anxious because of all the news, and maybe they have a little bit of fever? But if they're short of breath and their oxygen levels are starting to trend down, that is something that I would take very, very seriously, and that person needs to go to the emergency room or talk to their MD or DO, immediately, and start kind of diving into why their oxygen levels are going down. Because with something like this, what we're seeing is people are 96, 95, 89, and then 70, and that's when they're going into respiratory failure. So it's quick, so you need to be on top of that data and make sure that there's some sort of follow-up with that. As TJ mentioned, at altitude, you probably are ranging in the 92, 93 range at baseline, and so it's important. So Michael said, so it's important to make sure that you take it into context of where your patients are located. So Michael C. from Longmont works as a personal trainer at YMCA. And I think the out of work is going to be going on for a while. So definitely the remote telemedicine, telehealth consultation is going to be extremely important. And feel free to throw some questions in there. I won't be able to be on the full call, so if you have any questions for me specifically, please go ahead and write them in there, and I'll try to answer them before I go. And then the last one that we wanted to check was blood pressure. So a lot of our clients are going to be, metabolic disease, so hypertensive. And so this one is a little bit more difficult to interpret, but it's really the extreme ranges that we're trying to look at. So obviously this person 120 over 80 is a great one, but with the elderly population, as they're getting sicker, you might start seeing their blood pressure drop. And that can be a sign of some sort of cardiogenic or septic shock. Taken into context with the other metrics, it's definitely something that is one that you want to watch closely. So if your patient normally runs in the 130s, 140s, systolically the top number, and then all of a sudden now they're starting to get down into the 110s, 100s, 90s, that is somebody who probably needs to seek medical attention. And on the flip side, higher blood pressure readings. And that can be from a number of things. You know, a lot of people are having a hard time getting their medications because their primary care doctors are closed. And so we're also getting a lot of calls for, you know, emergency medications to get their blood pressure under control. So it might not be even related to COVID-19, but if you see your client who has high blood pressure issues and are unable to get their medication, and you see that number trending up, maybe something to refer them to a telemedicine or their primary care doctor. So those are really kind of the main ones. I think the takeaway point is take these together in context, and obviously you can't make, you know, necessarily medical decisions, but we can help guide our clients in terms of when to seek medical attention. And I think at this point in time, that is going to be extremely valuable to the people you're working with, because a lot of this is really reassurance and trying to get them pointed in the right direction.
Yeah, I would add to that, John, that for a lot of people, it's also just helping them with prevention.
Yep.
And helping them just get some peace of mind for them and their family members. So positioning this as a way just to get some baseline data, just to have some peace of mind. I think that's equally important as the diagnostic component. And as health coaches, this is a fantastic way to engage people, especially remotely, asking them to just start logging a reading once a day. They know that you have access to it, that you're able to provide some valuable service to them. So there's ways to start using this as an engagement tool now and as a preventative tool now, as much as it is diagnostic at this point.
Yeah, that's such a great point. I mean, I was asking myself the other day, when has the collective, all humans on planet Earth, had this much awareness and intention around their own health and their immunity and their ability to live a healthy life? And so for practices now, no matter what exactly you're offering, like, we're here to, like John and Dave said, to really serve as that platform to help you support this opportunity to capture your clients, to capture your patients whose awareness and interests around their top health metrics and tracking their health is so important right now. So
yeah, and just to add to that, TJ, I think a lot of people are going to have a wake-up call, and a lot of people are going to realize that excess weight and persistently elevated blood sugars and lifestyle choices that we've made up till this point have actually put them at a much higher risk. And hopefully that is another opportunity for you guys to engage and say, okay, this thing has let up a little bit, but we need to make sure that you're not in that high risk category if this ever happens again. And obesity and metabolic disorders, that's like culprit number one. So these are the metrics that are very top of mind for everybody. But as we continue in the demo here, we're going to show you the rest of the platform and how you can use this to start working with people on weight loss, blood sugar reduction, body composition changes, all of the health metrics that they need to meet.
We've had a couple questions pop in the chat box, which I think we can address real quick in a second. But first, John, we don't want to keep you on too much longer. John, if you want to stay on for a couple more minutes, if you have specific questions for John about these metrics, about what he's seen in his practice, etc., we're happy to answer those. So please put those in the chat box or in the Q&A section. I know some people were asking, Theodore asked about monitoring respiratory rate. Troy, you asked about any devices like the Oura Ring. Yes, actually, we do have an integration with the Oura Ring, and we are much beyond just tracking in Excel. You asked, how is this different than keeping a log in Excel? We have lots of integrations. We will show those in a second once John hops off. But I think John, do you want to talk a little bit about the respiratory rate?
Sure.
We pull that from Oura Ring, but I know that's harder to just see as quality data if you want to speak to that.
Yeah, and I think you guys can talk about all the integration and how this really streamlines the ability to track data versus doing an Excel spreadsheet. But so Oura does pull in respiratory rate. Obviously, this is the respiratory rate at night. which can be valuable. And so the platform that we just went through with the 4 tiles is a streamlined version specifically during this period of time that people can use. We've made it free for everybody as our way to kind of give back to society and say, look, at this time, we need to be able to help in any way. So please use these 4 data points. But the platform is a lot more sophisticated than that. And I think Dave and TJ will go into that. But you can pull it from Aura data. And so, again, I think Theodore asked, what are you looking for with respiratory rate? So on average, most healthy adults are going to have a respiratory rate of anywhere from 12 to 15 at rest and per minute. And so, again, when we're talking about COVID-19, the respiratory rate is going to be extremely important. If people are starting to become hypoxic, the oxygen levels are going down. And so if you start seeing the respiratory rate, especially at night, is starting to trend up, you started getting into 20s, 25, 30 ranges, those are people that need to be really looked at more closely. So it gives you another idea of where their overall kind of respiratory state is. So to answer Theodore, you really want to see if that is starting to trend up and consistent too. And let's see. So Raja said they are
we can actually show a demo of that, John, for Theodore. We'll show you how you can use this on some of the Aura metrics like respiratory rate to look at a person's baseline and then start to look for anomalies.
Yeah.
We'll cover that in a few minutes.
Yeah, and maybe pull out the Aura HRV CV, which I think would be a good one also to discuss with the group.
Definitely.
Okay.
Cool.
Yeah.
Awesome. So, John, if you want to hop off, is there anything else you want to mention around? As John said, what he went over, this is a free COVID-19 dashboard we're offering to the individual to use, and that includes you all. I know you all might be actual health professionals, but you can use this personally. If you are interested in actually using the full-on system or full platform in your practice, which, as we said, we're going to give you a full background on us and a demo on that soon. That is not free, but we'll explain how you can use it specifically now inside of the whole COVID-19. But John, if you don't have any other points to hit, it's been great to have you on, my friend.
Sure. Thank you so much for everybody. And if you guys can just share my contact information, if anybody has any questions, feel free to reach out down the road.
And just to highlight, John is on with us every month. So we're going to explain in a second the opportunity to stay involved with Heads Up and join what's called our Founders Club. So the first 100 health professionals use our platform in their practice. And as a part of being in the Founders Club, you get access to us three, Dr. John Lemansky here. We host a monthly mastermind for all of our clients. We have a private Facebook group. So we'll get into all of that later, but it's the 4th Wednesday of every month that John and us lead a new webinar, a new mastermind for all of our members.
Yeah, we go pretty deep. We were supposed to be doing a deep dive on the Aura metrics this past week, but we swapped it out for obvious reasons. So each month we go deep onto a specific wearable device or how to use specific metrics like heart rate variability. So we go deeper into a lot of these numbers, a lot of the sophisticated integrations that we have. So that's just part of the member benefits if you're using this in your business. So I guess, Doc, if you want to sign off, and TJ and I, there's been some questions about the product. I think we should probably clear up first, TJ, like, does this thing do anything besides Excel?
Yeah.
So maybe you could start there.
Exactly. So what I'm going to do real quick is just kind of give a little background on us and our company, and this will be real fast. So number one, we've solved for the overall outdated healthcare system problem, and we kind of support these kind of 3 markets in actually creating health. So chronic illness, high performers, proactive, healthy. And the main challenge that we've been solving for is how fragmented health data is in the world. These 5 categories represent how fragmented the data is from testing companies, operating systems, patient portals, and device companies like the Oura Ring, which was mentioned. So our solution from day one has to integrate all of these data sources together on one easy to use platform. And then we support you, the practitioner, with applying personalized solutions and protocols to support your clients with making data-driven outcomes in their business. So we've been direct to consumer from day one. We've got over 30,000 members in over 60 countries. And so you can think of it as an electronic health record for the individual. And it integrates both clinical and lifestyle data all on one easy to use centralized data dashboard. And now what we recently launched a couple months ago was our health professional solution. We're basically responding to coaches and doctors coming to us, asking us, how do we get access to our clients' data? And so we've launched our new coaching and practitioner portal that gives unprecedented real-time access to lifestyle data to remotely monitor your clients and patients from anywhere in the world and then personalize your protocols. So the opportunity to get involved with us in the short term is to join what's called our Founders Club. As I mentioned earlier, it's the first 100 health professionals to roll heads up out in their practice. And you get access to extra bonuses like the monthly mastermind I mentioned. We can help you customize your dashboard, which we'll give you a demo in a second. And of course, preferred pricing. So we'll get into everything that's included at the end of this call, but maybe now we can answer a few more questions and go into the demo a little bit more. I know some people have put some notes in the chat box. Erica, I think she had to hop off. Troy, you said you were only referring to the 4 tiles about the manual connection. Yes, we support both manual data entry and automatic connected devices. Yeah, and as David said, we are intentionally simple with the COVID dashboard. Oh, Erica, you're still on. Great to hear. So anyways, Dave, if you want to start to give a little bit of a tour about our platform here, and we'll go from there.
Yep, just to get everybody on the same page here, we'll just talk about the larger platform as it stands. And like any good data platform, it has the ability to be very customized to the specific type of individual or individuals that you're working with. So there are 2 sides to the program. The side I'm showing here is what happens when you, as a healthcare professional, log in. And what you'll see is a list of all of your clients. It's very easy to invite a new client. You just put in their email address. You can customize the message to them. It'll land in their inbox. As soon as they register, they show up here as a connected client. And you'll have different ways to interact with that individual's data. And I'll show you how all of that works here momentarily. But this is the primary interface on the client side. So the next part of it is how do you start feeding data in from your users? And each of your clients will basically be able to set up their own dashboards. Let me get to that here. And this is where they can integrate the Apple Watch, they can integrate the Oura Ring, they can integrate BioStrap, Elite HRV, pretty much every sophisticated wearable device app. All they have to do is come in here and connect up their scale at home, their wrist tracker, their glucometer, their scale. If they don't have connected devices, as I showed earlier, it's very easy to punch this data in manually. If they do have a connected device, it will automatically feed in. And what we do when you first sign up with us as a professional, part of the onboarding, is we actually create a custom dashboard with you that all of your clients are going to see. So we'll go through the 50-odd lifestyle metrics that we have, and we'll plan out exactly how you want your clients to see the dashboard, which tiles, in which order, from which sources. It'll have your logo on here. So it's a very personalized dashboard for each client. Also, very important to note that we have a very sophisticated way of tracking lab test results. So in the United States, we are able to electronically synchronize from over 90% of the healthcare systems across the country. So this becomes very easy for you to have your individual patients or clients come in and sync up Quest Diagnostics, LabCorp, Stanford, UCSF, et cetera, all the data you really need to see to understand how well your protocols are working at a medical level. Is this person's hemoglobin A1C coming down as I modify their diet? Are this individual's inflammation markers improving, their HSCRP, for example, as we put them on a specific diet? Are their thyroid antibodies coming down as I put them on autoimmune paleo? Is this person's deep sleep or VO2 max improving? So that's where all the blood work comes in. And again, you'll have access to all of this. We have some very sophisticated data visualization tools. So you can come in here and pretty much run a report on anything you want. So I want to look at my client's deep sleep, and I want to look at that over the last 4 weeks, and I want to see how they compared to the previous 4 weeks. So that's what I would be able to do here. I'm just going to take blood oxygen off the graph so this is a little clearer. Hang on a second. So just with a few clicks of the mouse, I've come in here and been able to detect that this individual has seen a huge increase in deep sleep over the past 4 weeks. So there's some very sophisticated data visualization tools. There's also ways where you and your clients can share documents. So this is a completely encrypted and HIPAA compliant file storage area. So reports from functional tests, DEXA scans, allergy tests, anything in an unstructured format can be stored here. And then again, you have access to all of this information. So I can just come in here, check my stats on a client, and then dive into their profile if I need to. So that's essentially what we're providing at a high level. It's very quantified, it's very prescriptive, it's very data driven. I can wake up in the morning and sort all my clients on their blood sugar levels. Or if I'm doing some proactive COVID monitoring, I may want to say, you know what, I really want to be monitoring body temperature on all my patients for the next month. So I'm just going to add body temperature. And now if my people are logging body temperature, I'll be able to very easily track that. So this whole table is completely customizable with the metrics you want. And that's essentially what it is. It's telehealth, it's remote monitoring, it's health optimization for your clients who are already healthy, sophisticated, fit, high performance. It's lifestyle modification for people who are working on comorbidities. So hopefully that gets us all on the same page. TJ, I'll kick it back to you and decide where you want to go next. Maybe there's some questions we can take and go from there.
Yeah, you bet. Thanks, Dave. I know Erica had a question briefly about syncing the medical data, which Dave, you may have covered briefly, but if you want to just
Yep.
You can integrate it automatically, and Dave can share that, or manual, so you can tell her about that.
Yeah, so all the patient has to do is log in, search for their medical provider here. All we need is the patient portal username and password, just like you'd connect your bank account to QuickBooks or Mint.com. So whatever a patient would use to log into LabCorp or Quest or Stanford, all they have to do is come in here and give us permission to electronically sync that data. It will all show up here. If they connect more than one medical facility, like this person, for example, we will actually download the data from the different medical facilities, put it all together on a timeline. So very quickly, we can help people see back, and you see back 5, 10, 15, 20 years into a patient's history just within a matter of seconds. And then if you're outside the US, or if for some reason we can't sync with your client's medical facility, it's very easy to come in here and just enter a few blood tests manually. Just come in here, pick the tests, and save it manually. We also have a transcription service that will do it on your behalf. So if you want to have some data transcribed for a patient, everything can be done manually or synced electronically.
Awesome. Thanks for covering that, Dave. Yeah, and I'm happy to take the helm back and share my screen. Got it. That was helpful. You're welcome. So far, only LabCorp and Quest for direct lab testing company integrations. Yeah, we're open to custom integrations and customizing of the platform, and have those opportunities for you guys as well. Just to highlight a couple of the features that Dave mentioned that are pretty exciting: our Smart Rows feature. This is allowing you to review all of your clients' core health data on one page, all at the same time. Very easy, and to check in who's in range, who's out of range, and reach out to them. And it's all N=1. So you can click into each client and you can get a historical breakdown of their data based on their own personal historical data. The lifestyle dashboard, of course, that Dave went over with you to centrally manage all lifestyle metrics. Again, this is able to be customized, as Dave mentioned, upon onboarding. So all of our members, our Founders Club health professional members using this with their clients, they get a spreadsheet that looks like this when they're ready to start with us. So in a second, I can share exactly what's included and our pricing and next steps for setting up a call with me if you'd like personally, and diving deeper. And then we can also get you a trial if you haven't even got on our platform yet as well. But when you're ready to upgrade with us, you actually fill out this spreadsheet and you prioritize. Over here on the left, you put a number in based on the order you want that metric to show up on your lifestyle dashboard. So the lifestyle dashboard, you can customize as a default so that your clients only see what you want them to track, so they don't get overwhelmed and so they can stay focused. And then we also allow for the manual data entry, and then have automatic integrations with over 15 different sources. So as Dave mentioned, to connect data, you come up here. This is devices and apps groups number 1. These are all the mainstream sources. So Withings, Apple Health, Google Fit, Fitbit, Garmin, MyFitnessPal. So it's really easy. The individual just has to sync and log in once to these platforms, and then all their data in the future from these platforms will automatically come in to our platform. And then the group 2 is the more advanced data sources, like we mentioned, the Oura Ring, which we've got a great integration with, BioStrap, another wearable on the wrist, and then blood glucose and ketone monitoring system, Keto Mojo, automatically pulling in blood glucose and ketone data from the Bluetooth meter, BioSense, a breath ketone acetone meter, and then we have nutrition tracking platforms that we integrate with, such as My Macros and Chronometer. So that gives you an idea of the specific integration partners that we have in the lifestyle metrics. And then, as Dave mentioned, the power of our analyzer, we don't just house all the data in one place, which no one really, that's the core problem we solve for. We also help you make meaning of the data. So the analyzer, the individual client, and you as the practitioner or coach have access to this. And you can do private calls like this to review and go through that client's data and start to chart it on the graph like I have here with some of my COVID-19 markers for a little prevention. Or they can do this on their own. And eventually next week, we're launching a brand new feature which will allow you to run PDF reports straight out of the analyzer, so that you can save them, send them to your client, have them easily review this, download it. And so that's launching next week. That we're really excited for that new feature. Anyways, Eric also asked, what glucometers are you synced with? Any other nutrition tracker?
Yeah, I'll respond here in the chat, TJ.
Okay, perfect. So moving on. So that's the analyzer. And just to kind of walk you through everything that's included again, and we'd love feedback here. I know some other people have put some great questions in, and love that this is of interest for people. We've got lots of support from our current members and our influencers that love our platform. These are a couple endorsements from some of our good partners: Dave Feldman from Cholesterol Code, Thomas DeLauer, Rob Wolf. Just around the power of you cannot change what you do not track, and how Heads Up really puts all the right data points at your fingertips. So now what I can do is talk about everything that's included inside of the Founders Club. Again, the Founders Club is for the first 100 health professionals to use our platform in their practice. This slide gives you a breakdown of all the value, everything that's included. Okay, so our standard Founders Club membership comes with up to 100 clients. This would be no cost to them. It's up to you in terms of how you want to position it. We recommend you position it as like a bonus or a value add, which can actually help sell your current offerings. We want you to use Heads Up, not just to deliver better outcomes, but to actually help you sell and promote your programs. So if the individual client were to sign up on their own, it would be $9 a month. So the total value there is $900 a month. Access to all your clients' data, the secure file storage of Dropbox, the Dropbox of health files that Dave shared with you, the analyzer to help analyze trends over time, and then that customized dashboard to really help you and your clients focus on tracking what you want them to track. We'll build that for you. That's included at a $100 value. And last but not least, the monthly mastermind with Dr. John Lemansky, who you met earlier. This is the fourth Wednesday of each month. Dave and I are on that as well, leading that. That's a $200 value. Great networking that happens inside of those masterminds. Total value for the Founders Club membership is about $1,500 a month if you add everything up together. But because you're joining early with us, the early adopter rate for being a part of Heads Up and using this in your practice as a member of the Founders Club is only $99 a month. So $99 a month gets you up to 100 clients, so about $1 per month per client. And again, this is only for the first 100 health professionals that sign up with us. So we're at about 50 or so right now, and we anticipate over the next few weeks or month or so, we're gonna close this. So we're gonna cap it when we get to 100. And then the pricing will go up, and we probably won't get as many of the bonuses, but we still have this available now if this is of interest for you. Plus, we've got some bonuses for you. Not only will we customize your dashboard, but we'll do an onboarding call with you. Both myself and Alex on our team will help do an onboarding call to review your goals and make sure your portal is customized for you. And then we have a private Facebook group as well for all of our Founders Club members to network and connect with each other there. Those bonuses are included. It's just $99 a month. No long-term contracts, can cancel at any time. Of course, we want this to be successful for you and your practice and your clients. So we want this to be a nice win-win for everyone involved. We're leading the data-driven healthcare revolution, and we're looking for health professionals that resonate with this and want to be a part of the cutting edge to help deliver better outcomes, better engagement with their clients and patients. And we're here to be of support for you all. So that early adopter opportunity is only going to be available probably for another month or so to join the Founders Club. And otherwise, at this point, we can ask questions. We've got 10 minutes left. We can answer any questions you might have, but these are your next steps. So number one, if you haven't already, we can get you on the free 14-day trial to actually start inviting clients and using our system.
Looks like you have the wrong link there, TJ. That's the user sign up. We should put the pro sign up in there.
Oh yeah, yep. We'll put the I'll put that. This is the link where they can actually choose to make sure that they.
Oh, I got you. Yeah, sorry, that is the right link. I forgot we.
Yeah. I'll put this in the chat box right now so that you guys have that. So that's the link where you're going to sign up. Again, I just put that on the chat box, so that is this page right here. You'll basically just click this link, start now, and then it'll prompt you to fill out this information. So you'll go here, start now, professional, and you'll just create your profile, name, email, and password. So that's how you do the free trial. And then you can also schedule a call directly with me if you would like to dive deeper. I'd personally love to connect with you one-on-one for a 30-minute call to learn more about your practice and your goals and to see if this would be a good fit. So this is the link you're going to go to schedule directly with me. And yeah, like I said, I'll put it in the chat box. This link is in the chat box as well. Excited to connect with you. if this is of interest. Anyways, that's the next steps. And as I mentioned, we would give you the spreadsheet. You fill it out, you customize your dashboard when you decide to upgrade with us. It's really easy to upgrade inside the system. And now we can take questions and help answer any questions that anyone might have about everything we went over today.
Just to add to what TJ said, beyond this, what ends up happening a lot of the times is small clinics or large clinics will come to us and say, hey, Dave, we've been using this. This is great, but we really want to start building in some custom features in here. And they may ask, can you do an integration with this other service that we use? Or we want to be able to record some subjective metrics, or we want our clients tracking a metric in your system that you guys don't have yet. So all of that stuff we will do as part of custom profiles. Typically, that's something that comes later on. We don't expect that we're going to have everything that every use case needs out of the shrink wrap. So the system does have the ability to create custom metrics, custom reports, custom ranges, custom lab tests. So as you expand the product, there's ways to really start to customize it for your business. But this is just an easy place to start and get up and running and have a really sophisticated tool to offer your clients, and something that integrates the latest digital health tech, but you can take it further if you need one-off customizations. So I thought I'd throw that out there.
Great point.
Not seeing any questions come in, TJ.
Yeah. Erica, Theodore.
Any parting
Roy.
shots from those on the line here?
What's that?
Just asking if there was anybody that had a parting shot before we sign off here.
And questions. How was this? Was this a value for you guys? Is this something that you think would be a value in your practice? Please let us know in the chat box. Erica asked if we saw her other question about what glucometers that we're synced with, or any other nutrition trackers. I think Dave may have answered that. Yeah, Dave answered that above.
Yeah, we our preferred partner on the glucometer side is the Keto Mojo, mostly because it also does ketones. So it does blood glucose and ketones. You don't have to do ketones, but it does both. So the Keto Mojo is our preferred partner there. We also sync the iHealth glucometer, and then if your client has any glucometer that syncs to Apple Health, they can just connect Apple Health to our system, and we'll pull it in there, which pretty much gets us 99% of the market that way. And of course, a lot of clients can just punch it in manually, especially the ones that are non-techy, low tech. They just wake up in the morning. My mom does this up in Winnipeg, Canada, and I monitor it remotely. She just wakes up, opens her laptop or the mobile app, and just punches the number in, and then I have access to it remotely. So that's how we treat the blood sugar stuff. Theodore's asking if we have a list of companies. Yes, Theodore, headsuphealth.com. We have an integrations page right off the homepage. You can see everything we integrate with there.
Inside this spreadsheet as well, Theodore. So I sent you this spreadsheet to customize when you're ready to upgrade with us. And this is these are all the sources that we pull in our metrics from. So yeah, you bet, Erica. And Troy, did we you had asked another question, but have we gotten all your questions answered? Like I said, was this a value for everyone? We're excited to get your feedback. One other thing to mention, we're going to have the ability to have bulk invites sent out soon, where you can upload a CSV file and invite multiple people at once, and have a custom link. So that's coming. Erica says very valuable. Awesome. Thank you for the feedback. And please put in the chat box, if you're on still, please put in the chat box and let us know if you want to start a free trial. So put because I'm going to look, we have to accept your free trials on our end. We're really mindful about who we work with. We want to make sure we're highly aligned in our missions together. So if you are wanting a free trial, if you're wanting to start a free trial, can you put a note in the chat box and just say, yes, we're interested, and then I'll be on the lookout for that. Otherwise, we'll follow up with all of these slides and these links that we mentioned. And We will be in touch with you all. This recording will be sent out. So if you're watching on the recording of this version and you couldn't make it live, we also would love to hear from you and get your feedback and hop on a call if you want to schedule a call. This is the link to schedule a call with me. Again, it's in the chat box, and we'll follow up via email with all of this. So Shiva, yes, you're on the free trial already. Theodore, you started your free trial. That's awesome. And we're excited that you all joined us today, and we're looking forward to possibly working with you in the future.
Thank you, everybody. Have a great day. TJ at headsuphealth.com, Dave at headsuphealth.com. Don't be shy. Hit us up. Thank you for your time today. We're very grateful.
Yes. Oh, and Troy says he's going to upgrade. That's awesome. So Troy, you want to use this in your practice, I think with the MD you mentioned. That's great. Cool. I put my email in there. Troy and everyone else who wants to upgrade, we can do a call, an onboarding call, and get you your spreadsheet. Awesome. Theodore's in too. Everyone's loving it. This is great. Well, we're so excited to have you guys be a part of the Founders Club, and we look forward to having you be on our next mastermind call later in April. So
thanks, everyone. Have a great day.
thanks, everyone. We'll see you.